Hello, hello.
Look at
See, we got
all of our friends. Hello, Lanika.
yes, we got
Glad you
Lenny.
could join us.
Yep, yep.
Miss Jessica, hello. So I invited you, so I guess we should be seeing you shortly. I don't know.
It didn't tell me anything, so I don't want to get too distracted with trying to do too many things. So we'll
Okay,
see what
cool.
happens.
Yeah, so Tamika, you have the floor. You want to?
Yes, so we're so glad for the month of May for our girl Instagram Live station. They have an amazing special guest, Dr. Mary Fleming, who is the president and founder of Scholars, which started back in 2014, where she hosts an active podcast to discuss health inequities with experts across the country. So just a little bit about Dr. Mary Fleming. She did medical school at Vanderbilt, where she then did her residency and her OBGYN residency at Meharry. And then she also went ahead to attend the Harvard Medical School Commonwealth Fellow, where she received her master's in public health. And so we have an amazing expert with us. May is Mother's Day month. It is Mental Health Awareness Month. And so we wanted to find a way to be able to talk about women's health this month and be able to really break that idea of womb wellness down and how it is correlated to women's health. So we're so glad to have you here. It is an honor. It is also an honor just, for us to say this is your first Instagram Live. So, what I'm saying, we get that credit, have you here.
Almost. She said she's done one other one.
So, what I'm saying, we're glad to be the encore.
Yes.
Yes, y'all are great for getting me back into it. Lanika, who's on, has been, like I told them, encouraging me to do this for a long time. So she's super excited.
Yes. Thank you for encouraging her, Lanika. Yes. So I was teasing you earlier. I was like, anytime you have to Google somebody's initials that come after their name, like you know they have some like power behind that name. So just talking to you, learning what you do, the care you have for women in general, like as an OB, as being working in Kayapa care, which I want you to talk more about. It just speaks volumes about you personally. So let's get to it.
For sure. So, we talk about, we are in a modern day world and, we have social media and we have a lot of people who, are coming into the, health and wellness space that are creating, I don't want to say new catchphrases, but, one of them that have been very popular recently, idea of womb wellness. And so I just wanted to, give you the floor and the opportunity to really talk about that. Like, what is womb wellness? What does that mean for women's health? And, help give an overall medical perspective on that.
Yeah, definitely. And I was saying that womb wellness is not a term I typically use as an individual, but I think it's an interesting place to start the conversation in thinking about, the term really is trying to get at this interconnectivity of women's health or people with uteri, their health, and how it's not a singular thing, but we're connected, and sometimes one system will actually exert its effects somewhere else, and that can happen in symptoms from the uterus. But I think what I want to push back a little bit on is centering women's health around reproductivity, right? And so those who identify as women, and that's pretty broad, and that may mean, even if you identify as a woman, it may mean you have a uterus, and it may mean you don't have one. It may mean you were born with one. It may mean you weren't. It may mean you used to have one and now it's not there anymore. And so we have to think about that in the context when we're talking about total body health. I think the other thing to think about is even those of us who are born with a uterus, like myself, there are many of us who just choose not to have children, right? So we don't center our health around reproductivity, and we don't center our health around children. But we talked a little bit about just the struggle with fertility too. And so we have to be sensitive around those who really have, strived to have children and couldn't. And so that can be very challenging, or if you've had losses, that can be very challenging. And so the other thing we talked about is how when we talk about total women's health, that we're connected from head to toe, right? So there's a lot of things when we talk about hormonal changes that don't actually start in our pelvis, right? They start in our brain. They start in our thyroid. And when we talk about the things that affect women's health the most, we talk about heart disease, right? And that is a whole body situation. And we talk about how things, like I said, can manifest in our pelvis that don't start there. So we can hold tension in a lot of different places. And we talked about, there are people, we very much identify tension headaches, like people, we get stressed out, we hold this tension in our head and our neck, and we have this, or people are like, oh, my shoulders are so tense. But a lot of people also hold tension in their pelvis. And so they might have pelvic pain. And we have to figure out, sometimes they land in the GYN office, and that's not actually where the problem is. The problem is a more of a total body or mental health thing. So I went on a little bit of a tangent. But the fact of the matter is we are complete people from head to toe. There are lots of things that affect what goes on in our pelvis. And when we think about specifically about our uterus as an organ, right? And our uterus as an organ is a collection of muscle fibers that is, so I'm an OBGYN, so I think it's a magnificent organ because it does so many things, and it changes and evolves through the course of our lives, and it has a lot of potential and potential to grow a new person, right? Which is amazing. But it also has the potential to cause discomfort, right? So we can have fibroids, we can have heavy bleeding, we can have severe cramps or pelvic pain. We can have ovarian cysts that cause pain and discomfort. And then, of course, just like anything else, it can go completely awry. And we can think about the cancers of the pelvis that cause us problems if gone unchecked or undiagnosed. So I'll stop there.
No, that was
Go ahead, Cam.
that was excellent. I like the term, like Tamika was saying, womb wellness, but it encompasses our whole being. Whether you're perceive yourself as a woman or you're born that way or whatever. So I just like how it can impact so much and that we don't even really know sometimes that, like, the stress of work or whatever can also impact everything, including your womb. So yeah, that's
Absolutely.
Mm-hmm.
For sure. I think, and I love how you're saying that, health, overall, there's so it's a holistic approach, something that's going on and have, cause and effect throughout your entire body. And so, we want to also keep in mind, with this being mental health awareness, we are here to talk about that holistic approach. None of us are licensed psychiatrists or therapists. But if there are things that you feel that maybe some things that we've talked about and you're unsure, please don't go and be like, well, no, Dr. Fleming said this, or Tamika or Cameron said this. So, we are not licensed, psychologists, psychiatrists, or therapists. When in doubt, if you have anything that is in question with your mental health awareness, please, seek the proper channels that are available to you to do so. So I just want to make sure that we clear that out before we get started. So as we're talking about this, let's slightly pivot. Talk to us about Kayaba Care, because you have done a lot of work, when we're talking about health inequalities and creating health equity, and bringing this awareness to the work that you've done. I've even seen that you've done work in Kenya, which is, really amazing. So just tell us about like that journey of, creating access for people, with Kayaba Care. Share more, a little backdrop with that.
Absolutely. So for me, and in your introduction, you talked about the fellowship that I did. So Commonwealth Fund Fellowship in Minority Health Policy, which was housed at the Harvard Medical School. And it's for physicians and dentists who are interested in working in health equity broadly. So we are doing all kinds of things all across the country. And so from that, I already knew I was an OBGYN, so I already knew I liked women's health. I knew I really wanted to work on the most vulnerable populations, and for us in this country, that's people who look like us, right? And our number, there's a lot of media attention right now about the numbers and the stats, but they're not new, right? This is the same numbers and the same stats from decades and decades and decades. And so even when I was in medical school, one of the things that I was looking at is the high rates of maternal mortality during pregnancy, whether that was from healthcare outcomes, right? So lack of access, lack of intervention in a timely fashion, just lack of appropriate care, right? And so, like, when we think about the Serena Williams stories, right? Like, she knew what was wrong with her. Like, she told them. They ain't listen, right? And so we have that narrative happens over and over and over again. And it's not that we're not going and we're not doing what we're supposed to do, but people aren't listening to us when we tell them what's wrong, on top of the other barriers or access, right? Having insurance, not having insurance. Where do we live in proximity to the next hospital? Does that hospital have escalated care if something really happens? And then once we get there, somebody listen to us. And so having that backdrop, training at Meharry, where we did wonderful care, where we took care of everybody and we treated them like whole people, and just really learning how you take care of a person, and that particular person as they walk in the door, and knowing that there are places that don't do that. That's kind of where like my journey started. And so I worked in Philadelphia, Norristown, right outside of Philadelphia, for 4 years at a community-based hospital. Loved that. My Montgomery Hospital family were phenomenal, and really had a good chance to gain my clinical skills there. But I knew I wanted to do something more, right? So there was this pull to, like, how can I work with the population that is the most vulnerable? And so fast forward a little bit. So there's a little Kenya stint in there. We can go back to that later. But one of the gentlemen that I met when I was working in Pennsylvania, his name is Olan. He called me and he was like, "Yeah, I just had a baby and there's some issues with maternal health." And I was like, "Yeah." He was like, "You want to do something about that?" I'm like, "Yeah, that's my jam." And so we actually just started brainstorming on, where, what's the need? What is the space? Using the skill sets that we had as individuals, how can we put something together? We pulled in a third person who was versed in the kind of the startup space, and really put together Kayaba Care. And so the goal was to meet people where they are. So we are a home-based, tech-enabled company that uses a position called the maternity navigators to bridge the gap between traditional prenatal care and all of the social determinants of health. So we want to make sure that your clinical bases are covered, right? So you're still getting your primary OB. We're not interfering with that. But if there's any gaps in that care, we're going to try to figure out what they are and fill them. And then the maternity navigators are recruited and hired from the communities that we ask them to go back and serve. So for me, it's very important, and this is an ongoing struggle. I guess it's not like we've got this all figured out. So I don't I don't want to give that illusion, but the goal is to work on this empowerment piece, right? And so how do we figure out how to empower our maternity navigators to go back out and empower women so they can advocate for them as maternity navigators, but also we want our members to be able to advocate for themselves when they go back to their primary OB. And then, like I said, we want to make sure we fill in those clinical gaps. So we have nurse practitioners on staff who are amazing. So, a lot of times, we go to the doctor and we're like, "I don't know, are they telling me the truth? Can I trust this? I don't know," type of thing. So you can come back and talk to our maternity navigators and our nurse practitioners, and they'll go like, "Yep, that's good. They're getting great advice. Do that." Or, maybe ask this question next time you go for some clarification. So we try to guide people that way. We try to make sure you get connected to a lactation consultant if you need that. If you get you need dietary advice, we can connect you to a dietitian. We're working on our doula service line. We know a lot of people, again, need that in-person support when they're on labor and delivery. So we're trying to develop that service line right now. So we're trying to figure out how to fill in as many gaps as possible. We can't do everything. So we also try to find community resources that already exist. I'm a person like we don't need to reinvent the wheel, right? There are people out there doing great work. Let's connect the people that need those services to the people who are already doing that great work. So trying to build those community relationships so that we can just build a network, right? Like, again, there's lots of people doing great things out there. So that's the origin story, the brief origin story of Kayaba Care and the work that we're trying to do. And we're housed in West Philadelphia, so that's where we are right now.
Yeah. And sometimes it's not about, what question to ask. It's about asking like the right question. So if you have someone to go to first and say, hey, what are the questions that I need to go and ask my OB-GYN, so I can get XYZ? I know it's, for me, the first time I was ever introduced to, a lactation consultant and, all of these things, it's actually after I had the kid. The kid.
She loves you. She does.
After I had my children, that's when they, brought in the lactation consultant and all these other people so I could ask questions about that. So to get that prior is just phenomenal, especially when you're working with underprivileged women who may not even want to breastfeed or know much about it. So that's really
Yeah.
Yeah.
And that's all the challenges to breastfeeding. We can have a whole another conversation about that too.
Yeah. I wasn't trained properly. Like it didn't no. Cause when I'm hearing her say all of that and then you talk like, oh my God, I was clueless, So, and I think some of it is like, oh, well, you're a woman, you have a mom, and like maybe there's an assumption that like you're gonna have family or you're gonna have support or you're gonna have, your aunties and you're gonna have this, when you go back home, where some women are going back home and it's just their baby, they may not even have, the father there to help them navigate. So I think you creating this network is just, so needed in our world today.
So doulas are rather new to the States, right? Is that something that's kind of new? Or, because I didn't learn about a doula until a few years ago.
Yeah. They're not new per se. They are gaining visibility is what I would say.
Okay.
And it's an interesting kind of evolution in thinking about the history of birth workers. And I'm not a historian, and so there's going to be some gaps in this story. But thinking about historically, especially for Black and brown women, especially for Black women in this country, when we think about when we didn't have access to hospitals, when we think about when we were having babies in the field and had to go back to work, right? There were traditional Black birth workers who were Black women who were amazing midwives, or the predecessor to midwives as we think about it today. And so if you kind of think about the evolution of birth workers and kind of the evolution of doulas now, like there's always been that birth support, right? Because especially for us, we didn't have anything else. We couldn't go to the hospital. And so I think, having that kind of history of how do you support women through the birthing process at home or near home has evolved into lots of things now. So, I mean, we still clearly have midwives who are amazing. And then we have doulas who are not clinical, right? So their job is not to deliver babies. Their job is not to give you prenatal care. Their job is to help you understand the pregnancy and delivery and postpartum process, and support you through that, and recognize that through that process, lots of things happen when you're pregnant, right? Your body changes like daily, right? So it's all this stuff is happening. Physically, it's happening to you. Psychologically, it's happening to you. You're still trying to negotiate all this other stuff. You got job, you got partner, you got parents, you got other kids, maybe so there's a lot of stuff happening. And sometimes you just don't know how to advocate for yourself in that moment. Sometimes you're entering a health system that's not designed for you, right? And so there are places that you go that you really need that support. And the other thing I think we don't talk about a lot, and before I won't go on a tangent, but we think about the actual delivery process. There's pain accompanied with that, right? Like there's some people have a lot, some people
Absolutely.
have a little.
Absolutely.
Try
100%.
Yeah. And trying to negotiate what you need when you're in pain can sometimes be difficult, right? And trying to figure out, is this pain normal or is it not? Is this pain making my blood pressure go up, or is my blood pressure going up because something else is going
Yeah.
on, right? Is
Right.
this bleeding normal or is this bleeding too much, right? And so I feel funny. Is this feel funny? Because it's, you know, like a lot of women will have a lot of shaking after delivery, and it's very normal, very common. So you have to figure out, is this normal shaking or is she having a seizure, right? Like, you know, and so there's stuff that we know because we see it every day.
Yeah.
But sometimes you need that extra eyes of support to say, no, this is normal. It's okay. Just relax, right? And so that's where doulas can be very helpful. And doulas are not just related to delivery or to prenatal care and delivery. There's postpartum doulas. There are doulas who will help with sleep training. There's also end of life doulas, right? Again, the same kind of advocacy support
Yeah.
pathway, since you know you're going through this challenging thing that's physically changing you, that's mentally changing you, and you need somebody in your corner to help process and make sure that you're getting all the things that you need. So I would say clearly I'm a fan of doulas. I think there's been some pushback on like everybody trying to find their lane. Like I said, they're not clinical, so they're not meant to provide you your clinical care. They're meant to support you through the clinical care, and they know a lot because they do this, you know, a lot. So they have a lot of knowledge and are very useful. So you know, it's evolving, I would say, and how we integrate amongst the clinical and support services. So I think it's growing. More to come is what I would say.
Wow, congrats. That's amazing. And where did the name Kayaba Care come from?
So when we were trying to come up with the name, you know, just like anything, you're trying to name your company, we go through all these changes. And Olan is Nigerian, and and I don't know if this was just a spontaneous idea. I don't remember now, but we started talking about the name Ayaba, and Ayaba is the Yoruba name for queen. And so remember, I was saying that what we're trying to do is be in an empowerment model. So part of our goal is to empower everybody, the people that work for us and the people that we serve. And so we really liked having that strong empowerment theme, but we didn't want to just use a word. And we also wanted it to make sense in the healthcare space. So we were like, we liked care because it feels it's engendering, right? Like it's soft, it's inviting, and so we were like, what about Kayaba Care? That sounds nice. So we have the root of the word, but something that's unique, right? Because we are a unique organization, and we wanted to have our own footprint. So it still gives us the unique feel with a strong background that hopefully engenders, something that's very supportive. And empowering. That's the goal. So we'll see how we do.
Yeah. Good.
That's so awesome. So, when we're thinking about, you taught, let's circle back now to like when you're talking about this holistic care. I know Lanika was just saying that she needed a doula after her second and third child after dealing, and if I want to correct me if I'm wrong, Lanika, postpartum depression. Let's talk like that, the connection of mind with overall wellness, and then specifically women wellness. What are some things that you can talk about being an OBGYN of how mental health and even maybe trauma impacts a woman's health?
Yeah, so we were talking about, so there's a continuum to this, right? So there's something called postpartum blues, which is very common after delivery, right? And so there's a few things kind of going on. We talked about all the things that happen to you when you're pregnant, right? There's the physical things, there's the hormonal shifts, and then you deliver, and it's kind of like a 180, right? There's no longer a person inside your body. These hormones are going a very different direction very quickly. You have, physical changes. And then you have to go home and take care of this new person. And so postpartum blues is very common. It's usually short-lived. You usually just need some support, some guidance, some coping strategies, and you get through that relatively quickly. When it lingers and it doesn't go away relatively quickly, then we worry about postpartum depression, which can be significant, right? And all the things that we think about with traditional depression can be associated with postpartum depression. So you can just be sad, you can be tearful, you can be fatigued, you can be hopeless. In severe cases, you can think about harming yourself, harming other people. So it can be very, very significant. We try our best to screen people for that. So people that we know have mental health challenges before pregnancy, we're very careful with them and making sure we check in with them often. We also screen, postpartum often to try to keep people from falling through the cracks. One of the things that we worry about and one of the things we try to solve for in Kayaba Care is the people who don't come back to their postpartum visit, and so we miss them. So that's one of the reasons we wanted to make sure we had an at-home component so that we can go to people's houses, because we know it can be difficult. If you have one baby at home, it can be hard to get out. But imagine if you have two or three, trying to get to your visit and the baby to the doctor, it's just like, a lot. So that's why we added the at-home component. But I digress. So all those things can happen with postpartum depression. And again, so how long things last just kind of depends. Like I said, postpartum blues is usually short-lived. So that's going to be days to weeks. When we get into like weeks to months, then we're usually thinking postpartum depression. When we get past the 6-month window and we're getting further away from delivery, then we're thinking, well, this might be full-fledged clinical depression, type of thing. And so kind of who manages you through that process just depends. Like I said, usually with postpartum blues, it's going to be support. So support from the OBGYN, your midwife, your doula, maybe even a therapist, sometimes familiar support is going to be helpful. Making sure you have people around you to give you a break. So, I think getting away from that concept that you have to do it all, if you have that availability. We also talked about people who go home and that's all they got. It's just me and you. Like, we got to figure this out, right? And so giving those people coping strategies on how can I deal with this if I don't actually have any support, or where can I find support if I need it and I just can't deal in this moment, right? And then when we think about postpartum depression, sometimes, again, it's still more that coping strategies, support systems, therapy. Some people need medication, and that's okay. And so we will get you on some medication that could be, again, short-lived, as long as you need it. But doesn't necessarily have to be forever. So it might still just be a matter of months to kind of get you over the hump. And then, like I said, when it gets to be longer past that 6-month mark, then we get a little bit more concerned that you might need more intensive therapy, probably, more of a medication line of thinking. Just kind of depends on what you need and how you're responding to the support you've been given already. So that was kind of like first part of your question. Second is like, how and when does mental health challenges manifest from something else? And we talk about trauma a lot. And there's sometimes that it's obvious, if you will, and that's not a great word to say, that, there are women who have sexual trauma, right? That come in and they can identify it, and we know it's going to be a challenge and we can work through it, right? Those are kind of the obvious cases. There are other people who have trauma and they don't remember it, right? It's suppressed. They haven't confronted it, and sometimes that will manifest itself in pelvic pain. And so we have to figure out, we go through the process of ruling out everything else, and then sometimes that will lead us to a diagnosis of mental health challenge or previous trauma that's been undiagnosed. And it doesn't always have to be sexual trauma. It can be any type of trauma that you're holding in somewhere, and wherever you hold that tension is where it's going to manifest itself. So so it's multifactorial, like we're complex people. And so it just kind of depends. But I think the important thing, especially as a person going to a provider, is, just building the relationship. Like, most people don't walk in the door and say, this is my life, right? But trying to find providers that you relate to. I say a relationship with your doctor or your nurse practitioner, or your midwife. It's just like any other relationship, right? It's a building process, right? You have to build trust. It has to be a good fit. If you go to this person and you don't feel like that person's listening to you, go somebody. If your insurance allows you, whatever, go somewhere else. You want a good fit so that you're comfortable, so that you can share, so you can get through these processes. And from the provider perspective, you want somebody who is patient, who listens, who's going to take care of your whole person, right? And so, that can be sometimes challenging for us, but we exist. And being patient with yourself too. Like I said, you don't have to feel like you got to walk in the door and put all your cards on the table on the first day, but building that relationship and trust will get you through some of those things.
So I have a question, since, this is Mental Health Awareness Month, and we're kind of encompassing women who can't conceive, women who have difficulty conceiving, or women who've had, miscarriages or whatever. Like, since we are encompassing like everyone, how do you apply like your career as an OB to these women who aren't necessarily having babies, but they still need your support?
Yes, so that was like a very layered question. Let's see where to start. I think kind of thinking about is people with. Well, let's start at the base. Like let's start at like what like GYN means, right? So it's interesting. We talk about OBGYNs all the time, right? But what does OB and GYN mean? So OB, of course, means obstetrics. So that's the practice of taking care of people while they're pregnant through their pregnancy course and postpartum care, right? GYN is the care for women along the continuum, right? And generally speaking, women and those who were born with uterine ovaries, right? So, and taking care of you through the continuum and making sure that you have all your preventative health, if you decide you want to conceive, your preconception health, and then how do you transition through like menopause and beyond, right? So that's the whole continuum. Along that, most of us practice both together, but not everybody does. But for the sake of this conversation, we'll say we all practice them both together. And when we think about fertility, that usually falls on the GYN arm of things before you get to the pregnancy part. And, for the most part, we want those who want to be pregnant to be as healthy as possible before they try to conceive. So that's part of the process of taking care of the whole person. We also know for most people in this country, 50% of pregnancies are unplanned, right? So 50% of your pregnancies are unplanned. You can be minding your business today and pregnant tomorrow, right? So that means you weren't planning. You didn't do your preconception health. You weren't taking your prenatal vitamins. You might have been drinking yesterday. You know what I mean? So all of these things are true, and we deal with them.
You may have had
but
that before you took the pregnancy test, just
in case it might be your last one. But so that's where we live. I mean, that's where we are.
Mine.
So, and thinking about that, optimally, you want to be as healthy as possible before you get pregnant. And then thinking about those who are trying to get pregnant but can't for some reason. Some of that is because your health status is not optimal. So for those who might have diabetes, right, we want to make sure your diabetes is well controlled. For those who have high blood pressure, you know, make sure your high blood pressure is as well controlled as it can be. For those who might be higher than their ideal body weight, right, we want to keep you as close to your ideal body weight as possible, because that also helps with cycle regulation and your ability to get pregnant, but also decreases your risk while you're pregnant, right? So all of those things we want to do to optimize your ability to get pregnant. Now, does that mean you optimize all your things? Are you still automatically going to get pregnant? No, right? You know, there's lots of, you know, medicine is not magic. So there's lots of things we still don't understand. And so there are people who do all the right things and still don't get pregnant. And that is not a failure on their part, right? It just, we're human, we're imperfect, it happens. And so we try to figure out as best we can, is there an anatomical reason, right? Is there something physically altered that we can fix that can help you get pregnant? Yes or no? Is there something in the hormonal pathway that's not syncing so that you're not having regular cycles? So it could be the part of the reproductive pathway when we think about not having normal cycles and how do we regulate that. People talk a lot about PCOS, right? And so that can cause you to have irregular cycles, so we need to fix that. You could have a thyroid issue. We need to fix that, right? There's some other, hormonal things that we can fix. Get your cycles together. You can have pregnancy. Then sometimes we fix all of that. We fix your structural problems. We fix your hormonal problems, and you still don't get pregnant. And so then we figure out if there's other things we can do. Now, also remember that it takes two to tango, right? You can't get pregnant by yourself. So a lot of times we also take the onus that it must be my fault. I'm the reason why I can't get pregnant. And that's not true. It might be your partner has something going on. So and historically speaking, not to be stereotypical, but there are a lot of this historical traditional male bravado that doesn't want them to think that it's them. And so some people are hesitant to have the testing done, so because they don't want it to be a male factor issue. So kind of getting over that stigma, not taking, and like I said, not taking it to heart that it's a failure on your part. It just, again, we'll figure it out. And then recognizing there's other options. I mean, we have the benefit, and not that it's always affordable, but we do have scientific and technology advances that allow us to be more interventional in pregnancy. We have surrogacy, we have adoption, right? And so there's lots of different ways to be a parent as well. And so just keeping your options open. If you can't biologically conceive, there are definitely other options for parenting as well. And I think the biggest thing for me is just not taking that burden as a, in insufficiency on your part, right? It's just, we're human, we're different, we're all kind of put together in a different way, and some of us can't make babies, and that's okay.
Yeah. And then we have Lanika, who doesn't even know how her last one came from, where they came So we'll tell you about that later. We'll talk about that,
Right.
how you got that last one.
Oh my goodness. Then sometimes this is a very random aside story, but we'll be in the delivery room and I'm with a patient who's pushing and they're like, I can't do this and I don't think I can do this because it's a process, right? It's a thing. And right, we wish the stork would just drop the baby off. And so, we'll get through the process and and it's such, I promise I love delivering babies because it's magical. That part is magical every time. It is a blessing that I feel so humbled by to be in the delivery room and be part of that process when a person or a couple or a family brings in a new person and that immediate like face of love for a person you've never met before. It's heartwarming every time. It doesn't get old. It's great. But then often I was like, I thought you told me, you couldn't do this. I was like, you want me to put the baby back? And they'll be like, no, I don't want you to put the baby back. But thinking about Lanika's like, well, I don't know where. Well, I said we can try to put the baby back, but I think it's too late for that.
I think that's, you talked about a lot of things that, even me as a mother, Cam's a mother, like I didn't even take into consideration. Like imagine a mother of maybe 3 children and she has to get to her checkup appointments, but her babies need this and maybe the one's out of daycare. Like how sometimes as women, our self-care becomes at the lower level of the totem pole just because we're trying to make sure that we're surviving enough to meet the basic needs of these little humans that we've helped create. And sometimes we don't even Philadelphia, I'm like picturing, what I'm saying, like that, what that would be like Northern Philadelphia or the Flats, just certain areas in that, and just like, okay, picture a mother in Philly, in the middle of the winter with 3 kids trying to get to her checkup. She gonna be like, I'm good. Let me go.
3 kids, no car, no childcare.
Yeah, exactly. So you just like that shook me to the core. Like when you said that, like, now I get it. Now I could see how the disparities happen.
Yeah.
Now where the inequities happen. And okay, let alone questions. I mean, I think it's really great that we have a lot of telehealth services now that like are available for women.
Mm-hmm.
But now you're talking about an internet access issue now.
Yeah.
You know, that the tools could be available, but what happened, you know, there's still a large population, even in the US, that does not have access to internet. So telehealth, great idea, but what about the mom who doesn't have that data service? So she's still left out of the conversation. That just spoke volumes to me, and I just kind of had to insert that because sometimes we quickly forget that there's a lot of mothers out there right now that have doctor's appointments tomorrow that probably aren't going to go because they don't have the support to get there.
Man.
It's almost,
I mean, and then
like, I could almost go in tears right now. Like, wow.
Mm-hmm. Mm-hmm.
And another population I think we don't think about is those. So I think a lot of people take for granted you get your 6 weeks postpartum or your 12 weeks postpartum after work. And that's still not enough, right? I mean, other countries do way better than us on that spectrum.
Yeah.
But a lot of women don't get that. And even if they get it, it might be unpaid. And so I've had women who had to go back to work at 2 weeks and 4 weeks because they had a job that did not cover. They can have the time off. You have to give them the 6 weeks off,
Right.
but it's not paid.
Oh.
So you've got a new baby, but you got to feed the baby and yourself, but your job is not paying you to stay home, right? So, you know, it's very interesting, like all of those nuances of people who have to make very complicated decisions. So if you've got a 4-week old at home, you're going to work at fast food restaurant or a factory even, you're not coming to your 6 weeks postpartum visit. You know, it's just not happening.
Wow.
So people, and, you know, because I think, and kind of talking to the health equity lane, and we don't have to go way down this, but there's still this notion that people get less than or have less access to because they are doing something inherently wrong, like it's a behavioral thing, or it's a circumstances thing, or it's a choice thing, and that's not what's happening here, right? Health inequities exist in this country because the system was not built to take care of us, and it's not built to accommodate people who have these competing priorities. So there's this, well, she didn't come to her postpartum visit, so she must not care about her health. Absolutely not. She couldn't get to her postpartum visit because of A, B, C, D. I mean, we can go down the list. And so how do we fix that? So how do we control for competing priorities? How do we not make people have to make a choice between their health care, to your point, like you putting yourself on the back burner continuously. And if you can't, you know, you can't pour from empty cup, right? We use that probably too much, but it's true, right? If we're not taking care of ourselves, we're not going to take care of all these people. And then, you know, Lanika said something about being a geriatric mom. I don't use that term. So I'm okay with advanced maternal age, right? That exists. Sometimes you do see still coding for geriatric moms or elderly multigravida. People say that too. But anyway, I digress. But thinking about people who have pregnancies a little bit later in life, now you're in that quote unquote sandwich generation, right? So you're taking care of potentially aging parents and children. And if you're working, you might be mid-career, right? And so that's a lot of things to juggle. And so we think about overall health. You might not just be skipping your postpartum visit. That might turn into skipping your annual appointment. That might be skipping your mammogram and your pap smear. You haven't gotten your cholesterol checked, right? It spirals. This is not like a one thing. And so we know a lot of women only access healthcare during their reproductive health years when they come to the OBGYN around pregnancy. And so I will get people like, I haven't been to the doctor since my last baby was born 7 years ago or 10 years ago or 12 years ago. And you're like, well, welcome back. Like, let's catch you up. You know, you don't want, you know, you want to be glad that they're there. Like, you know,
and that
the
only time that they're getting their blood pressure checked or getting lab work to check for, you know, different things. And so that's just like a very important thing. And then we don't have the time to do it. It's just like, now what? Now you could potentially have another crisis on your hands dealing with a stroke or, you know, whatever.
Absolutely.
Yeah. So that's just, you know, very unfortunate that we have to make a decision. Like, do I go to my doctor's appointment? Do I take care of my kid? Or, you know, whatever may be the case. And in 2023, like, we really shouldn't have to be making those decisions with our health. Like, it should be a given that, speaking of children, No, go ask your dad. I'm on the phone.
Love it. Love it. I mean, it never stops. You can't turn it off.
Man,
No.
and, yep, you're so right about that. I think it's really interesting. I was just about to say something, and then I lost it about with modern day medicine, people still not having access, but also like how that compounds the whole thing of like stress. So now you have, I don't know what I don't know, micro stressors that are like building and building and building and building, and then you're not getting the opportunity to go seek the support you need, and you're just like, I'm fine, I'm fine, I'm fine. And it makes me really think about like so many women that like I know, or like people that I know where, mothers passed away prematurely, and it makes me think of like what was their narrative, or what were those things. So like with talking about women's health, of course you're not a licensed psychiatrist or therapist, but like what are some things that help, like from a mindfulness perspective, support healthy women's health? Aside from, of course, we know you want to go to the doctor, you want to make sure, you're getting your checkups, getting your labs done, but what are some things that you could speak to that support women's health when we're thinking of mindfulness?
Yeah, and I want to touch on something you just said before we get to that. When you talked about like the micro stressors or the microaggressions, and so in the Lord, now I can't talk. In the health equity conversation, there is something called weathering. You might have heard about that. That
Oh, this
this chronic
okay.
stress, right? Chronic stress over time will actually change your person, right? And not just your person, but also the progeny that you may have. And so you can pass down the effects of that stress to your to the pregnancy and to your next child. And so it is a process that we need to decrease the stress, because it's not just about us, it's about our children as well. And so that weathering is a thing, and that happens, and we see it chronically over generations. Like, we can go back and look at Black women through slavery and through Jim Crow and through civil rights. Like, you know what I mean? Like all of that, it's part of our DNA, right? And so it attracts through generations. So that's one. And thinking about what can you do to kind of mitigate stress on your everyday life. And I think most of the things are the things we would think about just in general, right? Trying to be aware of it, like, just understanding, like anything else, naming a thing, like, I'm stressed and that's okay. What do I do about it, right? I'm having a hard time, I'm overwhelmed. Recognizing, and sometimes it's not always hard. I mean, it's not always easy, and this is slightly TMI, but like sometimes I'm having cramps. I was like, now, is that GI or is that my uterus? I'm not sure. Like sometimes you have stuff and you're like, I don't know what's hurting exactly, right? And I say that to say, like, sometimes you're tired, and is it tired because you were up all night with the crying baby last night? Are you tired because something is wrong? And so I don't know if we always give ourselves the space to like really dial in and figure out what is exactly happening to us and not dismiss it, right? And so sometimes it is a crime. I was up at 3 o'clock, the baby was crying, I'm tired
And that's
today. But you shouldn't then be tired every day for the next 2 weeks, right? So we just need to keep checking in, like, okay, this might be normal today, but it's not normal for this to keep going. And so then I think the next thing is to understand what your social support is, right? So like you said, a lot of us have mothers, aunties, sisters, really close friends. Having those relationships that you can be vulnerable with somebody and say, I'm having a hard time, or this is happening to me. Is this normal? Does this
Yeah.
happen to you too? And hopefully, I think more of us are being that vulnerable space with each other, and allowing us, kind of taking away the need to be in control all the time. Sometimes you gotta let your guard down,
yeah.
um, and let somebody help you. Like, right, check on each other and let somebody help you. Like, it is okay to let somebody help you. And then I think the next thing is talking to somebody. Like a therapist is just a therapist. Like it is and the way I keep explaining it to people lately is that I had a patient the other day and I was like, who are you talking to about this? And she was like, oh, I mean, I've seen a therapist before. I was like, I said, it's not that you're not, it's not a mental health disorder. This is not the space we're in. You've got a lot going on. You need a safe space. She was like, I don't want to burden my friends with this. Like, I don't. Everybody needs a safe space. Everybody needs a place where they can, because we're humans and we have complex lives and we're not perfect and sometimes we just need to let that go. Um, and so a lot of times that's what therapists are. They are a place where you can be your 100% vulnerable self. You get a safe space to leave things that you don't necessarily want to burden your family and friends with. And they're a person who can help you with coping strategies if you are overwhelmed in the moment, how to sort that out. And the last thing is, if you need medication, it's okay, right? Mental health is a chronic disease like anything else. Sometimes it's acute, which means it just lasts a little bit, right? We have we have other medical conditions that happen for 3 or 4 months. You take some medicine, it gets better, you move on about your life. And then there's other things that last a long time. You get diabetes, you should keep it. So you need to be on medication for a long time, right? It just doesn't go away. And so depending on what your challenge is and how it manifests in you, and those are all normal. Those are all things that can be accounted for and treated. And so I think just giving ourselves a space to say, well, this is my diagnosis right now. I'm going to treat it, and then we'll see how it goes and we'll reassess.
Right.
So that's again, I went off again a little rogue.
I mean, to speak to that point, if we were having chest pain or a chronic headache, I mean, we wouldn't just say, well, I'm just going to sit here with this and try to figure it out by myself. You would go get some professional help. And I feel like it's the same with our mental health. Like, we can't just take it lightly when there's something going on and we need someone to talk to, or we need medication. Like, it's the same thing. So, yeah, and I like that. And also, when we do have children, when, people do start having children, we tend to isolate a little bit because of that person, that little baby. And, we don't have as much time to go out and socialize with our friends or even just get outside and go for a walk. And so I would say, not as a mental health professional, but just try to still keep your network, your people close to you, try to get sunshine, as much as, take the baby out or whatever you have to do just to kind of get out,
Yeah. Yeah, and that's a great point that I didn't bring up. I mean, like physical health, right? Having, taking a walk, exercising, meditation, yoga, like whatever your lane is also can't underscore enough how important it is to take care of your physical person as well. And also thinking about, you think about non-traditional hobbies. We used to, I think when I was a kid, every grandmother had a hobby, right? They had something they were doing, something they were collecting, something they were knitting or crocheting or something, right? And I think we've kind of moved away from that because we're so busy. We're always running around. I guess we have social media, but that's not a hobby. But I think kind of thinking how you can go back and have it, because that's kind of a form of meditation, right? Knitting is grounding, right? Crocheting is grounding. Painting is grounding, right? And so like fishing, even like things that are you go and you're in that moment and it's calming. So think about other things you can do that kind of, I mean, my stepmother has coloring books and she colors all the time, which I think is really great too. So it doesn't have to be something that you produce something, but it's how do you give yourself a space to get out of your head and ground yourself into something that's tangible and physical.
So while we have about 5 more minutes, and I want you to just real quickly give people your IG handle for Kayaba Care and your other handle for Reede Scholars.
So Kayaba Care is just Kayaba Care. So we're on Instagram and LinkedIn. Our new marketing director is like, I think we're gonna get on TikTok, and I'm like, oh my gosh, I'm still kind of scared of TikTok. And then Reede Scholars, we are on IG. We're also on Facebook and kind of Twitter. Kind of probably phasing Twitter out soon. And then for me, the best way to keep up with me is actually on LinkedIn, which is just my name, Mary Fleming.
Fleming with the one M.
1M, yeah, 1M. I used to say Fleming, 1M, no S. And then, yeah, that's usually because that's kind of, you'll get a little Reed Scholars, you get a little Kayaba, you'll get a little like random other things that Mary does. LinkedIn kind of the best way to kind of keep up with all my little lanes.
So I want to do I want to ask you a few questions real quick, kind of like a little brain teaser. You can answer like with one word or less.
One word.
One sentence. Sorry, okay. One sentence.
Okay.
All right. What is the best advice you've ever got?
Ooh. Stay true to yourself.
That is a good one. That's a good one. What is, on the other flip side, the worst advice you've ever received?
You're doing too much. Slow down.
Okay. What's in your purse right now?
In my heart of hearts, I would prefer not to. But my best way to travel is to put my driver's license, my credit card, and my lip gloss in my back pocket and keep it moving. So my friends get mad if we're going out and they have a purse. I'm like, can I just put my stuff in your purse? I don't need a purse.
Like, can you hold my phone?
Oh, this will be real quick.
Yes, that's but usually that's all I really have is some type of payment mechanism, some lip gloss, and probably some receipts I need to throw away.
What's the last book you read? Or what's your
yeah, interestingly enough, surprisingly, the last book I read was not one I would have picked up, but it's called Lady Parts by Deborah. I'm going to jack up her last name. I think it's Kapakin. It's probably wrong. But it's a memoir. Very, very interesting. She frames her part of her life story around her exposure to the healthcare system and her and some of her diagnoses, to keep it short. So it's very fascinating. Her life story is fascinating. She talks about being married. She talks about raising children. She talks about dating. But she also talks about the healthcare system and how it's attached to employment a lot of times. And because she's a journalist, so a contract worker, she was in and out of the healthcare system and how to negotiate that when she was having medical challenges. And really talking about policy issues. I mean, it's a whole thing, but she's a really great storyteller. And so, because sometimes memoirs can be a little slow, but this one it's quite entertaining. And like I said, it wouldn't be something I would normally pick up, but I enjoyed it.
All right, Lady Parts. Last question. What's on your nightstand at night? Like when you're, like what do you keep on your nightstand?
These days, 3 things. A bottle of water because I wake up thirsty in the night. Typically, I take off my jewelry before I go to bed, so usually that's on my nightstand. And what else? What's the third thing? Just depends. Maybe a book. It might be a book. Sometimes it's my laptop, unfortunately. Just kind of depends on what I'm doing.
Well, thank you so much for joining us. We thoroughly appreciated all your advice and your insight into these things. You're welcome back anytime. We would love to have you back.
Thank you for having me, and hope I didn't go too rogue.
No, we loved it. We loved it.
Perfect. You're excellent. And thank you so much. You brought so much awareness to things sometimes as women, we could take for granted. So thank you so much.
Thank you. Lady. All right. Enjoy your time in Hawaii, and we'll see you soon. Bye.
Bye.
Thank you for listening to Reede Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.